Hello and welcome back to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. This is part 2 of our show on diabetes. We're talking to Tracey D. Brown. She is the CEO of the American Diabetes Association. And we started part 1. Tracey was telling us her story, how she became diabetic during pregnancy, and how once she gave birth to her beautiful daughter, the diabetes stayed. And so did the baby.
Yes. Thankfully.
So we've been talking about food.
Yes.
And you were saying how you can manage your diabetes through eating the proper things, or not starving yourself or feeling like you're denying yourself of certain things. You can just kind of, if you eat rice twice a day or 4 times a day, maybe you can eat it twice a day. Also, there are some foods that'll fool you. You're thinking, okay, I'm eating granola to stay healthy, and oh my goodness, things like granola can take your blood sugar through the roof. I'm drinking a smoothie. I had a smoothie this morning, but it had pineapples, mangoes, bananas, all those high glycemic fruits in them.
Yeah, and that's it's just confusing, right? Food is one of those things that are confusing because what is healthy and what's not healthy and so the examples that you use are perfect. If you look at the contents of what's in a granola bar, just turn the package over, you will actually see that it's actually high in sugar and high in carb. And that for someone living with diabetes or pre-diabetes, or you just want to manage your blood sugars, those are the things that you actually need to say, I'm not actually going to do this granola bar because of the high carbs and high sugar. Same thing with those smoothies. So what is interesting with the smoothies, they actually put sugar in smoothies. So wherever it is you're getting them, or if you're making them, there is always the nutritional content, which I asked for. And you look at that nutritional content, and then what will you see? Sugars and high carbs. So there are a few smoothies, if you buying them through, one of the establishments that sell them, that are actually lower in sugar and lower in carb. And when I encourage people to have those, it takes a little bit of getting used to because.
Yes, and I'm the smoothie queen.
Okay.
I drink smoothies every morning, but I put, I think, the right stuff in it. I do blueberries.
Yeah, what do you put in there?
I put in blueberries.
Okay.
Apple, and you don't have to have a great big old apple. A small apple. I love spinach. Yeah. Baby, and you can't even taste that baby spinach. Yeah. And strawberries. Yeah.
So those are all lower glycemic index fruits.
And cashew milk, to me,
that's fantastic.
Makes it creamy. But I have to be honest now. It's not as sweet as what you're going to get at the established. It takes a minute to get used, but once you do, you won't be able to tolerate the sweet smoothies that you get from the smoothie places.
That's exactly right. And just think about, Stephanie, the impact now that you're having on your body as you have migrated from, as the smoothie queen over here, to actually creating a smoothie that isn't as high in sugars. It doesn't even sound like you're adding sugar. So you're using the natural sugars in these lower glycemic index fruits with spinach. That is much better than where you were, right? And so I try to tell people, work your way to the goal, because I think people get, if they think it's all or nothing, it will just be nothing. Right.
They will get frustrated. Well, what can I eat?
That's exactly
I can't eat this. No, I'm not going to live like that.
That's exactly right.
But I think, too, that you discover foods that you may not have tried before.
Yes.
If you just open yourself.
Yes. I have, when I first started getting serious about what I was putting in my mouth, in my body, I have people tell me, like, you can't go without eating carbs. You can't go without eating carbohydrates. But over time, when you actually start to discover the foods that you were not accustomed to having that didn't actually have sugar or were not carbs, you figure out that there's a whole new palette out there.
Whole world.
That's exactly right, Stephanie.
Of foods.
That's exactly right.
Let's talk about the medications that are used, or that diabetics use. I currently take the pills. I've never had to inject.
Good. Thank God.
Myself with it, because I'm an exercise freak. So
Yeah,
I've always tried to manage things through exercise. So it's been manageable. But I tell you what, when you hit 50,
things change.
things change. So it becomes harder over the years to manage that. But there are a lot of people who are on different medications, on pills, or you know, having to inject themselves every morning. And for some people who are struggling in this economy, it's not always easy. You've got some senior citizens taking half dosages of things.
The cost of insulin and prescription drugs is unbelievable, Stephanie, and this is a very real issue that people who are living with diabetes should not have to decide whether I'm going to take the medicine that I need to live, or pay my rent, or put food on the table, or be able to have a car. Like, that decision should never, ever have to happen. And the fact of the matter is, the cost of insulin has risen so high over the last few years that it is making it unlikely for some to be able to purchase the medicine. And that's where you get to missing dosages, rationing their insulin, not taking it at all. There was a survey that was recently done that said something like 40% of the people who use insulin have made a decision based on the cost of insulin that has affected them. Either they're skipping the dose, or they're deciding not to buy food that day, or whatever. That's an awful place to be. And that's one of the things that the American Diabetes Association has taken head on. That's not okay. Access to the medications that you need to live, to survive, to thrive, that shouldn't be a choice. Everybody needs affordable access to insulin, to their prescription drugs, to care.
So what are you guys doing to address that?
So we have been heavy advocates on the beaten path of this for quite some time, many years. Our first effort was to bring the entire ecosystem, because again, this is one of those things where there's no simple answer. If you think about the ecosystem around the creation of said medicine, all the way down to getting to the person who needs the medicine, there's about 6 or 7 players in there. There's the drug manufacturer, there's the drug wholesaler, there's the pharmacy benefit manager, there is the insurance, there's the actual pharmacy, and then it gets to you. Along that complicated ecosystem, we started by bringing people to the table and saying, look, enough is enough here. We need to get together and figure out how to solve this problem. And one of the things that we have been pushing into is transparency in that large ecosystem. Where is the money added and taken away? Why is it so expensive? Who's actually putting monies in their pocket? Like, how do we, at the end of the day, get the medication that the person needs at the lowest possible cost? So we've been pushing on transparency in the supply chain. We have written a white paper that outlines several things that we could be doing differently. And of course, I spend a lot of time on Capitol Hill. We spend a lot of time advocating on behalf of people living with diabetes, trying to drive legislation to lower the cost to the person living with. We have about 500,000 registered advocates. We have, I have employees all around the country working with the state and local government level, as well as working with the federal level. One of the recent successes that we had is Colorado becoming the first state to put a cap on the out-of-pocket cost for medicines to people living with diabetes. We need to get the other states right on that path, but those are the things that we wake up every single day fighting for, the millions of people who need their medicine to live.
Are there any assistance programs on the state, local, federal level?
Yes, so there are a lot of programs, and I think many, again, people get confused on the complexity of the rules around what you need to do, who can get access to said programs. One of the things that we did at the American Diabetes Association is we tried to be a consolidator of information to make it easier for people to understand what are the programs, what's out there, and then how do I apply to get it. So we created a website called insulinhelp.org, specifically for people to go there if you are struggling, if you, for whatever reason, don't have the money to get your insulin. There are several resources available to help you get the medicine that you need. The problem is a lot of people don't know about them. And then
That's
if you
why we're here.
do know about them, it's complicated. There are forms, right? There's forms and procedures that you actually have to go through. And so we're trying to help just consolidate all of that and make it as easy as possible. And I will tell people, if you're struggling with insulin, call us. Call us or go to our website, diabetes.org, and we will help get you connected with the places where you can get the insulin that you need.
Because there's so many people who are in need. What do you feel about the fact that the number of young people who are being diagnosed has doubled, tripled over the last couple of years? I don't know whether it's because everything's supersized. I don't know what's going on, or maybe our parents' generation, they ate more from the ground. A lot of them come from agricultural backgrounds, and we're farm folks, and ate healthier than we eat now. But there's just, and I'll go to my kids' high school, and I'll see some really big kids, some really large kids. And it's like, what are we doing? Are we not informing our kids on how to eat right? What is happening, Tracey?
Yeah, I mean, Stephanie, there are 25,000 young people a year diagnosed with diabetes. That's crazy, because this is our future. And like you say, we have to ask ourselves, what is actually happening? What is going on? I do think times have changed quite a bit. There is a link between obesity and type 2 diabetes. We know that today our young people, not all young people, are not as active as they used to be. You know, I have to tell my daughter to go outside. You know, the computers, the phones, the this, the that. When I was growing up, we didn't have all of that. Mm-hmm. So we were outside, running around, playing, doing all of those things.
In the summertime, my mother put you out at 8.
That's exactly right. That's exactly right.
You can come back for lunch.
That's exactly right.
But you better stay out there and figure out something to do. So we played.
That's exactly right. And I think that is not the same. It's not the same time. The other thing is around food. Everything is about easy access, fast, run, on-the-go food. Again, I don't know, when I grew up, we sat down as a family and we had a meal. These young people today are in so many activities, doing this and doing that, that sometimes families aren't even sitting down eating anymore. They're picking up on the go. And some of this pick up on the go food, as we talked about earlier, are high in carbs, high in sugars, processed, refined foods, all of that stuff actually isn't good for our bodies. So I think we have that, the lack of activity, the kind of food that is happening.
And the easy access,
the easy access to all of that. And then there's just the lack of awareness, period.
As we talked earlier about the silent killer, a lack of awareness. Like you said, by the time you're diagnosed, your blood sugars, this stuff has been going on in your body for years.
My daughter knows her numbers. Why does my daughter know her numbers? Because I make sure she knows her numbers, right? Like, this is now just a part of our lifestyle. Part of the programs that we have at American Diabetes Association is going to the young people. We actually have a camp, a summer camp that we do for children living with diabetes and their families. To give children who are living with diabetes a tribe. They can get with their tribe, and they can you know, just have fun without stigma, without shame, without all of these things. But the flip side of that is also just to raise awareness with the family unit. We're trying to go into schools. You know, there's still a lot of discrimination that happens in schools with children. We need to improve that. We need to drive awareness, and we actually fight against this discrimination. Do you know that children who are living with diabetes still today in some school systems are forced to actually leave the classroom? They can't actually take their insulin. In places that don't actually have full-time nurses, sometimes children are denied going to school. All of that stuff is kind of crazy. These are the things that we are actually doing to fight for our young people, but a lot of this is just lack of awareness and ignorance around what can be done to manage this disease.
I'm going to play devil's advocate with the school thing. What do you say to parents who would object to a student pulling out a needle in school to take their insulin?
I say nothing, because that insulin is required for the person to live. What do we say to children who need corrective eyewear so that they can see the board? What do we say to the children that need a hearing aid to hear? Right? Like, to me, it's a part of living. And so that class needs to be educated around what is actually happening.
What about those who would say that that it can be a safety hazard? How about if another child gets a hold of that needle, and so many things can happen as a result of that, uses that needle as a weapon?
I say that there are safety hazards all day, every day, in schools, every single day. Again, this is about the rights of children that are actually living with a disease, a chronic disease. They need their medication to live. They need to be able to take their insulin, their blood sugars on a regular basis. There are hazards that exist in a school every day, all day, Stephanie. This is something that is required for someone to live. Those children deserve a right to be able to take the medicine that they need to live.
And you're right about the fact that in a lot of schools, the nurse isn't there every day. You have a nurse that may go around to different schools, but there's no nurse there every day. So
That's exactly right.
What is the child to do?
They miss a lot of school, which is unfair. And that's the point. That has a level of discrimination. And the level of discrimination against people with diabetes, again, this plays into the silencing piece of this. You know, we had a landmark case that we just won around discrimination for truck drivers. Do you know that people with diabetes were discriminated against with their CDL driver's license, their truck driving license? The same for pilots. Just had a land-breaking case that now allows people living with diabetes the same standards, tests, things that you have to do to be a pilot. Someone living with diabetes can do that as well. But there's discrimination everywhere for people living with diabetes, which is another reason why people don't say that they have it. Who wants to deal with all of that?
But what would be the danger as a truck driver having diabetes? I'm just asking.
Again, I even hate playing into the stigma, but there is the belief system that if you have too high of a blood sugar, you know, there are consequences to too high and too low. But if you're managing your blood sugars, you're not going to have those issues. But that's what people would say. Well, you could have you could go too high, or you could go too low, or yeah, there's 1,000 things that could happen to anybody. Someone could have a heart attack. Someone could, right? Like there's 1,000 things that could happen. People living with diabetes should be afforded the same rights as anybody else.
And like you said, there are a lot of stigmas. And so a lot of people will not admit that they have this.
That's exactly right. I mean, and it goes, you can take it, athletes, there are a lot of athletes that are living with prediabetes or diabetes, Stephanie, but they won't tell because of the implications, potential implications to their contract, right? Like there's just, it's very complicated, but what people need to understand and know, diabetes can be managed. And when managed, you can avoid complications. But if everybody's silent about the issue, we're never going to get there. And here's the thing, diabetes costs this country $327 billion a year. We cannot afford for this disease to be silent.
Do you think, and I've got to ask, do you think there's a connection between the discrimination and the fact that there are many African Americans who suffer?
Yeah, so, you know, minorities are disproportionately affected. But here's the stat that is worldwide. 1 out of 2 people are living with prediabetes or diabetes. So while there is a disproportionate number of people living with diabetes that are minority, what you can't ignore is that 1 out of 2 people are living with pre-diabetes or diabetes, which means the disease doesn't discriminate. So everybody is now affected. And I do this, and you should do this the next time you're in a room. You ask people in the room, raise your hand if you know somebody with diabetes or is affected by diabetes. I've done this, and inevitably, almost every hand in the room goes up. And then I ask, do you talk about it? And usually people say no. But the same story that you told me, my family, my mother, my father, my grandmother, they lost their leg, like everybody knows somebody. And that is why we talk about the fact that diabetes actually connects us. And we're all actually connected for life. And diabetes is that thing. Everybody has a responsibility to actually start to raise the flag on this disease.
And when you, just like if you see something in the airport, say something.
That's exactly right.
If you see something, or if you see, we saw my mom get her leg amputated. We saw her taking insulin for years and years and years. And she always took very good care of herself. Yeah. She always ate right. She was never overweight. Was concerned about her physical health, yeah. And it got her too.
That's exactly right. Everybody knows somebody, Stephanie.
And like you said, we are all, and she comes from a family of 13 brothers and sisters, and half of them struggled with diabetes, yeah. Amputations, just the stuff that goes along with this dreadful disease.
Exactly, and that is why I am gonna continue to keep having the conversations, raising the flags, because I do believe that if more people understand what they can do to control it, there would be less suffering and there would be less dying. People can live with this disease for a very long time, and we're not going to continue to give up fighting for a cure. So the American Diabetes Association, fighting for a cure and research is still a very, very important part of what we do.
Where are we with that, though?
Listen, we and many others have been fighting for a cure for a while. Like I said, we were founded in 1940 by physicians. And our very first founder and president, Dr. Cecil Stryker, said that the only reason for being for the American Diabetes Association is to fight for the person living with diabetes. Their medical, their economic, and their social problems are our problems. And we're going to continue to look after them while we fight for a cure. So we're still fighting. And I think that because this disease is so complicated, like I told you, there are multiple factors around what actually causes diabetes. We don't know, and we haven't pinpointed, and neither have any of the other organizations that are researching and fighting. We don't have the answer yet. We're making progress, we're learning things, but this is why I think this needs to be an all play. If one entity, if we could have solved this by now, we would have. If there was a silver bullet, we would have actually already shot it. This is an all play. Everybody has to come together in new and different ways to figure out how to eradicate and take this disease down.
Well, Tracey, we could talk about this for the next 8 hours. Unfortunately, we only have a minute left, and we will give all of your information, American Diabetes Association information, the website that you mentioned. We'll put all of that on the end credits.
Perfect.
So that if people want to find out more information, especially that website, that's very valuable information on what you can do if you can't afford your medication. That really concerns me.
Yes.
That people are walking around taking half dosages.
It's true. It's very, very true.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today has been Tracey D. Brown. She's the CEO of the American Diabetes Association. Again, it's been an absolute pleasure. I'm glad I opened up a magazine in the doctor's office, saw your face, got in contact with you.
Thank you. Thank you, Stephanie, for the important work that you're doing and for bringing awareness to this deadly disease. Thank you.
Thank you. You've been watching the Sisters for Fitness Wellness Show. Have a great day.